Do not use hormonal contraceptive. Do not until you're done bearing children. But if you really want to use it, please limit its usage, at least until you're done bearing the number of children you want to bear. Secondary infertility is becoming very common, really common. And one of the leading causes is illicit use of contraceptives. There's a reason why they are called emergency contraceptives, for crying out loud. I cannot finish this video without telling you that some infertility issues result from your men, okay? Low sperm counts, testicular issue, poor sperm viability. Secondary infertility refers to when a woman is unable to get pregnant, or even if she gets pregnant, she's unable to carry the pregnancy to term, despite her having had children before. I've been told so many stories of secondary infertility by friends, at work, and even on these media spaces. And most of it, if not all, usually result from the use of hormonal contraceptives. Recently, I've been told a story of secondary infertility by my matron, an infertility that led her to having only one child until she finally hit menopause. My matron said so many personal things I wouldn't want to indulge. She said so many things. But one of the most important parts of our story that I want to share is the fact that she said at a stage after she had her first child, which was a girl child, she was very indecisive about if she wants a child immediately or if she wants to stay for years. And so because of her indecision, she began using contraceptives randomly. Like, she would use an emergency contraceptive, and then after that, when she meets her husband again, she's going to maybe use it 2 months injectables, and then sometimes she had an implant being given, and then she would when she decides or felt like it's going to be a foreign object or she doesn't like it, she's going to go and remove it. It was constantly using hormonal contraceptives, a lot of them. And then finally, when she had a little bit of friction in her marriage, she decided to put the one that's going to take 3 years. I am not saying that might have been the cause, but she was so sure, she was really sure that was the cause of it. And somehow we always have our hunches. You know, when I told you in one of my videos about you looking inward and seeing what is the cause of your infertility and starting from there, even after the doctors have told you you're fine, yeah, I think that's it. Our hunches are always right. There's been a recent high surge of illicit and rampant use of emergency contraceptives by single females. And I recently realized that even the married ones are also indulging in it. There's a reason why they are called emergency contraceptives, for crying out loud. Emergency contraceptives like Postinor 2, Plan B, morning after pills, they are for emergency sexual intercourse. They're not supposed to be used frequently. But I have seen our young females, including the married ones, consuming it like water. I'm not saying you should not do family planning or you shouldn't take contraceptives. I am just saying you should be realistic. If you know you are frequently having sexual intercourse or you have sexual intercourse frequently, well, how about taking or doing a family planning that is longer? All right. This longer family planning have been researched, and they're not supposed to act like the emergency contraceptive act, right? Okay, and then if you don't even want to take the chances, how about the most safer options like Billings method, where you calculate your self period, or withdrawal method, or even using condoms? Okay, that way you know you're safer, right? You're not taking anything that's going to mess up with your hormones. I've been trying to put up a video on family planning and which method is very appropriate for you, right? So yeah, expect that video and trust me to do a thorough work of it. Yeah. Apart from illicit use of contraceptives, so many other things could lead to secondary fertility. One of it is age. Whether you like it or not, a woman's fertility reduces with age. The quality and quantity of your ovarian reserve or of your eggs is going to reduce as you age. if you're a woman. So while you set your life goals, while you plan on things you're going to enjoy, while you think of your career and you postpone giving birth, or even if you've had children before, one child or two, and you paused and decided to, do a lot of things while planning to have children, remember that as you age, your fertility also reduces, your ovarian reserve reduces, and your prognosed, or you're predisposed to developing secondary infertility. Then there is the numerous fertility issues women develop, right? Endometriosis, fallopian tube scarring, even blockage. And if you unfortunately develop an ectopic pregnancy, then you are at risk of, damage to one of your fallopian tube. Okay, then we have the numerous infections we develop, like PID. Then we can even, you can now think about uterine cancer. Then you think of uterine polyps and the rest. Then you now have to go to fibroid. The chances that every woman, or 1 in 3 women, is going to develop fibroid. Then there is the numerous hormonal issues, right, like PCOS. I'm going to attach my video on fibroid and on PCOS, polycystic ovarian syndrome, to this video. You just have to click on the description and then click on the link, and it will direct you to the video. Now I'm going to talk about signs of secondary infertility. Okay, one of it is irregular menses. Okay, if you have small menses, your menses is too light, or it's too heavy, or not even having menses at all, right? So if you have irregular menses, if your menses is too heavy or it's too light, or if you're not even having menses, we've had situations where some patients have not seen their menses for 6 months, some have not seen it for a year, or some have not seen it for lots of months. And so yeah, that's a very big cause for alarm, even when you've had children before. Concern is if you're diagnosed with any hormonal problems, PCOS, or any deficit in hormones. Okay, it definitely means something is going to be wrong. And even when you've had 1 children, you could also develop infertility issues again. I have the most important signs and symptoms, the cocoa itself, which is delay in getting pregnant or having numerous miscarriages, right? Even when you've had children before. Now I'm going to talk about treatment, right? Treatment of secondary infertility is usually based on causes. Okay, what is causing your secondary infertility based on your diagnosis? Okay, if it is hormonal issues, you replace your hormones. Okay, if it is fibroid, you look for a fibroid surgery and remove it. If it is polyps, if it is infections, if it is whatever is causing it, is how you're going to have to treat your secondary fertility. Then of course, due to assessment, some supplements are also recommended, and any good gynecologist will definitely place you on supplements. Okay, anti-aging supplements and antioxidant supplements. Okay, I'm going to give you supplements that contains antioxidants and anti-aging supplements that are going to help you revive your fertility. It's going to try to balance your hormones also, in addition to hormonal supplements. That's if your problems is actually related to hormones. Then if the secondary infertility is from the man, because we can't actually talk about infertility without also talking about the part the male has to play. I cannot finish this video without telling you that some infertility issues result from your men. Okay, low sperm counts, testicular issue, poor sperm viability. Okay, so don't ever think of treating yourself or fighting infertility without involving your husbands or your sexual partners. Yeah, and then very, very important, talk to your male or your spouses about the possibility of IVF. IVF has helped a lot of couples, and it is still helping. And then if you want to take a step further, there is also surrogacy. Thank you so much, guys, for watching up to this extent. Please subscribe to my channel once again, and yeah, give my video a thumbs up.